So good afternoon, everyone, or good morning if you're calling from the UK. Thank you for joining us today to discuss what we can do to support student mental health. So my name is Nina and I will be hosting this webinar today. And we should be taking about 45 minutes of your time today, which will include an opportunity to ask questions from our speakers at the very end. So just a couple of introductions before we start. So we are joined today by Dr. Dominique Thompson and Naomi Wilkinson, and I'll just let them introduce themselves just quickly now, and we'll start with Dominique on the left.
Hello everybody, I'm ready to talk you through some common issues and also to take any questions. Thank you.
Morning, I'm Naomi. I'll be talking through our new Being Well programme after Dominique's spoken.
And just on the right hand side, that's me. So I work in the Epigeum marketing team. So here is our agenda for today. First, we will hear from Dominique, who will be presenting on the current state of student mental health around the world. Then Naomi will introduce our newest project, which will be an interactive online toolkit called Being Well, Living Well. And then after Naomi's presentation, we will wrap up with a Q&A session. As I mentioned previously, please do feel free to type up questions in the question panel on the right-hand side. So we are now ready to start, so I'll just hand over to Dominique.
Thank you, Nina. Thank you, Nina. That's great. Okay, so if you could go on to my first slide, please. So just to give you some quick background, I was a university GP at Bristol University for 20 years, and for the last 7 years, I was the head of department there. I introduced quite a lot of new innovations, such as an in-house eating disorder service, which became citywide, an in-house emotionally unstable personality disorder, and quite a lot of other skill mix innovations. And so it was lovely last year. I won an award for that. So essentially, I've now moved sideways into more strategic things, helping other universities to improve their student mental health. Thank you, Nina. Next slide. Okay, so although this is national context, it could be international as well. What I think we are all seeing around the world, and the studies tend to come from the USA, Canada, the UK, and Australia, New Zealand, is that we're seeing an increase in the number of young people presenting with mental health issues. And those increases are genuine increase in prevalence. We're not just seeing more people come forward because they feel more able to talk about it, which is good, and some of them do, but in national studies, prevalence studies, population screening, there are genuine increases in the number of people screening positive in the age group 16 to 24. And that is for what are called common mental health conditions, such as anxiety and depression. We're seeing a lot more self-harm, we're seeing more eating disorders, and that's reflected also in our hospital admission statistics. One of the things we have to recommend, and this is the slide on the left of your screen, this slide is really helpful because it shows the age at which mental health conditions start. So the onset of mental health conditions tend to start, and you'll see that they all seem to go up between the 15 and 19 and 25, 29 groups. And obviously this is the age at which most people go to university. So we've got, if you like, the biological tendency to develop a mental health condition is exactly the time where people go to university. So we've got this natural, if you like, tendency towards it, plus we've got this rising prevalence, presentations. So we're going to have a quick think about why that's changing. What, if biology's been the same for very many years, what else is possibly changing? Okay, next slide. Just to put it in context, just as I said, this is not a UK specific phenomenon. I've put a few statistics there just pulled from around the world, but what we've definitely seen is a worldwide trend with more of our younger Generation Z, if you like, presenting with more problems. And although around the world some of the factors may vary a little bit, what we're going to just look at in a minute is some of the factors in common, the ones that are likely to be affecting most of our young people. Okay, next slide. One of the questions that people who've been working in higher education tend to ask or think, or the older generation often think, is that being a student would somehow be protective. So, you know, they're at university, you know, won't they be sort of somehow better off emotionally than the rest of the population? And the answer, unfortunately, seems to be no. What we can see there is a graph that was done for last year's Not by Degrees document, which, if you haven't had a chance to look at it, is a really great summary of all the evidence so far gathered together on student mental health. But essentially, it just shows us comparing the latest generation of students, who are the purple ones, how they compare with not only the year before, so the green, but also young people just aged 20 to 24 in the population, which is the one in the red. And then in the blue is the rest of the population, the whole population. And we can see that being a student means that people tend to feel significantly less happy, that life is less satisfying and worthwhile, and more anxiety inducing. Next slide. So people want to know why. What is different? Why is this generation, you know, less happy, more anxious, more depressed? Why are they harming themselves more? And so we are starting to get some of that research coming out. And I'm not a great one for reading massive, great research documents all the time, but if you are going to look at one, I have to recommend the perfectionism paper that came out at the end of last year by Curran and Hill, the one that states that perfectionism is on the rise among university students. That was a study looking at over 40,000 students from a variety of countries. So they looked at collective data. And one of the things that it showed is that there has been an absolutely huge increase in perfectionist traits among young people at university. So we think, well, would that matter? And of course, perfectionism, as you'll be aware, is linked to a whole range of mental health conditions. So it's linked to anxiety, it's linked to eating disorders, depression, self-harm, obsessive compulsive disorder. So if we see more perfectionism, we are going to see more mental health conditions. But why are we seeing perfectionism? So obviously we're looking for what's happening that might be driving that. And it does seem that the world has become increasingly competitive. Everything that you look around, and that's why you might notice the picture of the cakes, that's not just a British thing. I've got nothing against baking cakes, but the question really is, why is it a competition? If you look at our society now, pretty much everything, especially the stuff that used to be, if you like, just fun, has become a competition. So whether it's singing and dancing, or cake baking, or photography, painting, sculpture, poetry slams, everything is competitive. So we have a whole generation growing up absolutely immersed in this competitive society. When they're at school, they can't just have, you know, a photography exhibition, it has to be a photography competition. Then they're competing to get into university, and there's been this huge shift from a few people going to university, so a few people used to go to university, and if you had a degree it made you stand out, to a significant proportion of the population going to university. In the UK, it's 50%. And so that means that getting in is very competitive, being at university, staying at university, and then graduating. It leads us to this sort of target-driven education system, where it isn't enough now to get a degree and just have an education. You actually need to get a first, and actually that's not enough. You need a postgrad degree. And so there's this increasing pressure piling on, which, to be fair, wasn't the same, you know, even 10, 20 years ago. So something has shifted. If you throw in a couple of other big factors, this the concept of meritocracy, that if you just work really, really hard, you'll get everything that you know you deserve. You'll get the happiness, the happy family, the great job. You know, and what young people don't realise, because obviously they are young and coming through, is that it isn't just down to your hard work. So they work flat out with this vision ahead of them that they'll achieve everything that they want to achieve, without really the understanding that, you know, sometimes you're just in the right place at the right time, you've had a bit of luck, maybe you know someone, maybe the interviewer that you have that day, you know, something bad happened to them, so that impacts on you. They don't really have this bigger picture. So they're being, if you like, misled by this concept that just working really, really hard will get them what they want. We then come to parents. Parents are involved like never before in higher education, and all the way through, actually, hovering often over their children's lives, over organising them, multiple activities, making sure that every spare minute is filled. So we're seeing some very, very involved parents driving their children, which on the one hand you might say, well, that's good, they're keeping their, you know, eyes on the prize. But on the other, that does put on a huge pressure added to already their own self-drive, that perfectionist tendency, which is unhealthy at the point where a young person will self-critique and, you know, delete all their work that they've done because they're not happy with it repeatedly. For example, you know, a parent who focuses on the why didn't you get 95% instead of 90%, or 100% instead of 95%. So those are the things that we're having to look at and that young people are having to manage, which are a big shift. And then sort of finally, the idea that they're never off duty. They are not only driving themselves and their parents are watching every step that they take, but everybody else is as well. So if you like, we can sort of throw in social media as a lens to magnify all of that. So that they're being constantly, if you like, graded and rated and monitored by sometimes their own social media. Obviously, they're choosing to do that. But if you're not, you then become isolated as well. So if we think about what's happening in that context, we can start to see that if you've got the biological imperative, which is that if you're going to develop a mental health condition, it's likely to be at that age or before that age, and then throw in all those other cultural factors, we start to see why there might be a rise in mental health issues. Next slide. So, what we know is that there are all these increasing problems. Obviously, to a degree, we're seeing those people come forward. They are asking for help in some cases. But actually, a significant number of young people will not seek help, do not seek help. And we perhaps don't always understand on an individual basis why that might be, although we do have some ideas about what prevents people seeking help. For example, there was a study last year to look at about 1,000 students, and about half of them were avoiding visiting their family doctor, their GP, when they were unwell. And we need to start to understand that better. Now, there have been plenty of studies looking at the barriers to help, and for students in particular, they worry about stigma and that they'll be discriminated against. They often don't recognise that they have an issue. They are not emotionally and mental health literate enough to know this is actually a problem. They probably think they can fix it in many cases. And another big issue for them is confidentiality. They worry that there won't be confidentiality. So one of the things that we need to think about as organisations, as higher education institutes, is how we can help address some of those issues to educate them as to why seeking help would be the right thing to do, a positive thing to do. They will be treated confidentially as much as possible, to understand when it's a problem, when this is a red flag. So we really need to think about providing that advice and information, but in an evidence-based way, and it has to be easy for them to access it. You know, something in your hand, on your phone. You need a safe, reliable way for them to get that information. Next slide. So essentially, this just to sum up the project that we're going to hear more about in a minute, but that it fits with this whole university approach that we're hearing about now. Certainly in Universities UK, there was a big document, online document released last year called Step to Change, which really encouraged universities to consider the whole university when looking at well-being. And that means not just focusing on the support services when someone turns up at the front door of the counselling service or wherever, you know, and then giving them great service. That's amazing. But actually, you need to go upstream. You need to be preventive. You need to think about the staff who are looking after them. You need to think about educating them before they get to that point so that they understand when it's a red flag, when to get help, where to get help, that it will be confidential, etc. And the idea is that this project addresses some of this upstream learning, that the universities can provide great counselling services, but if nobody is going, or only half the number of students are going, because they're afraid, or they're worried about stigma, or they don't know what they're dealing with, they're frightened because they've got these symptoms but they don't know what it is, then we're not really dealing with the whole university. So we want to really address that upstream provision with an evidence-based approach, encourage them to help each other, but also give them the lifelong skills that this is an opportunity to learn about it for themselves. They can support their friends with this information, but they can also support younger students later on, so that we don't get to the stage where, you know, tragedies happen and terrible things could be avoided because the student just didn't know where to get help, was paralysed by, you know, fear or not knowing or shame or worrying about what other people would think. So we really want to go for the whole university approach and have this preventative project. Thank you.
Thank you very much, Dominique. I think that was a really useful overview of the situation. So everyone, you'll be able to ask Dominique questions at the very end, so please do keep those questions coming. So just before we go into Naomi's presentation, we'd just like to ask you all an audience question. So have you, at your institution, noticed an increased number of students on waiting lists for support? And have you had difficulties in meeting this demand? So, perfect. So I think most people will have answered now. So 83% have said they have experienced both of these things at their institution. And I think this leads really nicely into Naomi's presentation on our new Epigeum toolkit, Being Well, Living Well.
Hello everybody. So Being Well, Living Well is a new toolkit designed to boost student well-being with practical skills and coping strategies to embed positive behaviours. We're inviting institutions to join our development group collaboration, which will involve attending a workshop in May 2019 and helping us to shape the content of the programme. The UK version will publish in May 2020, and then the Australian version will meanwhile be adapted to reflect specific differences in culture, healthcare, financial support for students and the law, and will launch in June 2020. Alongside authors, reviewers and advisors, we'll collaborate with universities around the world to make sure that our programmes are effective and relevant. These collaborations are called the Development Group. What does the Development Group do? Development group members collaborate with the programme's lead advisor, authors, reviewers and Epigeum to shape the programme by agreeing to the detailed course curriculum, participating in the programme launch workshop, as I mentioned that will be in May 2019, peer reviewing the materials as they are worked into courses, so we will have a reviewing period in the summer next year, and arranging for students and staff in their institutions to potentially appear in the course videos. Input from the development group members ensures that our programmes closely match what universities really need, resulting in high quality, well-rounded resources. So the benefits of joining an Epigeum development group will be access to premium interactive content at a speed, quality and level of investment that's unachievable for a single institution. Campus-wide unlimited license to the course material in perpetuity with anytime, anywhere access, significant input into the planning and development of the courses, and full technical support and implementation training to assist you in getting started or customising the content. Development group members see this as a really positive experience to work with their peers and to help produce outstanding and applicable programmes. So an overview of the new toolkit, Being Well, Living Well. This programme takes a preventative approach, offering the general student population a complete toolkit on well-being, and therefore enabling student support services to focus their attention on those students requiring additional support. It will support positive mental health and promote healthy behaviours within the student population, helping students to maintain a good quality of life, which is an important factor in student retention and academic success. Developed in conjunction with wellbeing, higher education and mental health experts, the modules encompass the wide range of issues commonly experienced by students, covering mental, physical, emotional and financial wellbeing. It will provide tools and tips for maintaining a healthy body and mind, and will be built using high quality content and sophisticated pedagogy to maximise student engagement, including interactive comprehension and reflection activities to check understanding of key concepts and focus on building self-awareness. The resource will take a positive and holistic approach to enable students to develop self-awareness and strategies for coping and prevention, while also signposting when and where to seek further support. Crucially, it's designed specifically for university students and aims to encourage proactive self-management of difficulties and reduce strain on support services to help them focus more on attention on students in crisis. So you've heard from Dominique already. Dominique's our lead advisor for the UK version of the programme, offering her expert advice and playing a key role in helping us to shape the content of the toolkit. The development group will include universities from the UK and Australia, but we'll be inviting an Australia advisor on board as well. And then we'll be working collaboratively across the two programmes. And as I mentioned, at the end, we'll take the UK international version and we will be adapting that with specific examples for Australia. So this toolkit is aimed at the general student population, providing essential advice and identifying behaviours that support good wellbeing, as well as identifying when students should seek additional help. It will be relevant to undergraduate students from pre-arrival through to graduation. It'll also be relevant to postgraduate students, with pods and scenarios highlighting key information for this group's specific needs. The language and tone will be very important to ensure the modules are not patronising and that students can identify with the information. Resilience will be a theme running throughout the programme, although again, careful consideration is needed to ensure this comes across in a positive and supportive way. The learning outcomes for the toolkit are that it will enable students to recognise common mental health issues and negative academic behaviours and identify effective coping strategies. Identify when and where to seek additional support for mental health and wellbeing issues. Develop strategies for supporting peers and understand the limitations of being a peer supporter. Understand the link between physical health and mental well-being and recognise the components of a healthy lifestyle. Identify practical considerations to ensure personal safety and plan finances and budget effectively. In terms of structure, the programme's divided into 4 strands and a total of 16 modules. The modules average about 20 minutes each, some will be a little bit longer than that, but a total of 5 hours across the whole programme. But these are not linear courses meant to be studied from start to finish, but a toolkit made up of distinct bite-sized modules that students can dip in and out of depending on their individual needs. And the platform's fully enabled for mobile phones, so students can access the toolkit anytime, anywhere. We're also planning to include a pre-test to identify which modules students would most benefit from in order to improve their personal well-being. So a bit more detail, the Feeling Well strand covers transition to university, mental health issues such as self-esteem and confidence, stress, anxiety and depression, and study pressures. The focus will be on highlighting signs and symptoms with guidance on self-management where appropriate and signposting for further help. Living Well looks at physical well-being, covering diet, exercise and study life balance and highlighting the links to mental well-being. Staying Safe and Well provides practical, non-judgmental advice to help students make healthy and informed decisions about alcohol and drug use. Further modules address healthy relationships, including respect, resolving conflicts and dealing with harassment and violence, as well as sexual health issues. Finally, students are given essential guidance for personal and online safety. And then Spending Well takes a pragmatic approach, providing a clear approach of financial management and budgeting strategies. So to the features of the programme. They're designed with a strong pedagogical approach, integrating a range of presentational and interactive activities to engage students. So the toolkit will instill in students a sense that they are not alone in experiencing difficulties in their academic or personal lives, providing a normalisation experience through the use of real student voices in scenarios, case studies and videos. These also provide opportunity to represent various student groups, for example, LGBTQ, care leavers, mature students, Indigenous students and international students. Videos and bespoke high-quality animations will be integrated throughout to explore key concepts and themes and incorporate student opinions. Poll activities are designed to dispel myths, reduce stigma and to demonstrate a sense that students are not alone in experiencing difficulties in their academic or personal lives. And students are more likely to speak to their friends when they're experiencing difficulties than they are to seek support from university services. The programme will therefore help students to recognise when their peers may be in need of help and also to know the limits of their responsibility through the use of peer support pods that provide tips for supporting others. Each module will conclude with an action plan where students can build a list of personalised steps to implement rational thinking and behaviours in their academic and personal lives. There are also opportunities for universities to customise the content, adding in their own resources. Our implementation team can also help universities to integrate the toolkit as part of a blended learning approach, and instructors' manual will include ideas for additional activities that will support the content. The benefits are that Being Well, Living Well will help students maintain a good quality of life, contributing to student satisfaction and success, inspire students to build self-insight and the strength and confidence to overcome problems, reduce feelings of isolation by incorporating the peer voice into the material, support positive mental health and promote healthy behaviours within the student population, and encourage proactive self-management of low-level issues. So I'm going to just move on briefly and show you a few screenshots from one of our existing courses, Consent Matters. This was authored by Brooks, the Sexual Health and Wellbeing Charity, and Professor Alan Berkowitz. So this is an online course to help students understand sexual health and promote positive change in the university community. It gives clear and practical advice, includes student quotes and perspectives. As you can see here, there's some practice scenarios and activities that ground the content in real life, give specific advice for difficult situations and show what consent looks like in practice. There are lots of practical activities as well as reflective quizzes, looking at boundaries and more factual quizzes, as well as a final course quiz, which results in a certificate. So these are all features that we can interweave into the wellbeing programme as well. So feedback on our Consent Matters programme. Over 55,000 students have accessed the hosted version of the course since publication, but that doesn't account for 50% of institutions that use the course on their own VLE. Feedback has been extremely positive. 88% of students surveyed had an overall positive impression of the course, and 83% said the course was effective in improving their understanding. Universities have also run their own surveys and had very similar findings. So that's it from me, and I think we're going to move on to the questions section.
Yes, so thank you, Naomi. We can now open up the discussion to take any questions from any of our audience members. I know some of you have already typed up some questions in the panel, but please do keep those coming and we will try and answer as many as we can. Okay, so I think this will be, the first question will be for Naomi. So are you approaching any local services that are also involved in these kinds of programs, such as the Desk, which is in partnership with Beyond Blue and Australian universities?
So we will work with the development group to identify where there are opportunities to put into the general content of the toolkit any useful resources. If there are particular organisations that would be useful to work with, yes, we can approach them. If there are very specific local services that you want to integrate into your own version of the programme, that's something that we could work with you in terms of customisation of the content.
Thank you. Then another question, will there be any modules on sleep?
Yes, there is a section on the study life balance that will definitely incorporate some information on sleep.
Perfect. So then another question, what will motivate students to complete this course?
So the idea of the programme is that this is kind of a first stop for students to find some information rather than having to go and speak to someone face to face. It's very easy, very accessible toolkit that will give them some immediate answers and help them to consider the various issues in terms of their own life and their own behaviours. So obviously we would encourage university service to promote this directly to students, and then it will be up to the students to access it as and when they need it. And that could be at any point through their studies.
Perfect. So then another question we have, are there any statistics on how online courses like this minimize risk for institutions in terms of mental health for students?
I don't have any specific statistics on that. It's difficult to measure some of those issues. I would say that you know, the programme doesn't necessarily seek to provide remedy or cure for those who do have specific mental health problems. It's a very much a starting point, a preventative approach to help people understand the issues and to see how they might affect their own lives. A lot of the toolkit will be by providing advice on where to go for additional support when students do have higher levels of need. So I hope that answers that question.
Thanks very much. Has anyone got any other? Oh, perfect. We've got a lot of questions coming in all of a sudden. So another question, what about men's mental health? Are there going to be any modules to support men who are less likely to access services, but who have higher rates of depression and suicide?
There won't be a specific module, but that's something that can certainly be built into the activities. As I mentioned, the activities and the opinions and the videos are a chance for us to look at specific groups of students. So as I mentioned, we might have LGBTQ, mature students, but yes, we can certainly look at men as a specific group where that's relevant, particularly in the module on suicide.
Thanks, Naomi. Then a commonly asked question, so how will you ensure that the material is relevant to Australian students?
Well, as I mentioned, we are going to be, the development group will include members from across Australia and UK and elsewhere. So we'll be producing an international version, an international UK version, but then we'll be asking authors to adapt the content specifically to add in local information for Australia, specifically where we've got opinions and videos. That will all be changed so it reflects the Australian requirements.
Thank you. I don't think we have any more questions, so we might wrap up the question and answer session there. If you had any more questions, please do feel free to contact us. So on the screen now, you can see our contact details. I know some of you may have already been in touch with us in regards to this collaboration, but we can give you a lot more detail in regards to pricing, timescales, or anything else, so please do contact us if you have any questions. We will also be able to provide you with a trial of one of our courses if you'd like to get a feel for how they look and function. And just as a reminder, we will be recording this presentation and we will send it to you so you can watch it again or share with any colleagues. Thank you so much, everyone, for attending this webinar today, and I hope you have a good rest of the day, and we look forward to hearing from you. Thank you.